let me introduce our esteemed presenter for today, Dr. Gina Vincent. Dr. Vincent is an associate professor and co-director of the Law and Psychiatry program in the Department of Psychiatry at the University of Massachusetts Medical School. She is president of the National Youth Screening and Assessment Partners, a MacArthur Foundation Models for Change Technical Assistance Center that assists juvenile justice agencies with the selection and implementation of mental health screening and risk assessments. Dr. Vincent has a Young Investigators Award from the National Institute on Drug Abuse to conduct neuroimaging research on youth with substance abuse problems. She has also received funding from the National Institute of Mental Health and the MacArthur Foundation for research studies relevant to risk for reoffending, mental health problems, and substance abuse among youth involved in the juvenile justice system. She has published, lectured, and presented research at over 100 international and national conferences and juvenile justice facilities in the areas of juvenile callous unemotional traits, risk needs assessment, adolescent substance abuse, and mental health symptoms in juvenile justice. She is also author of the recent publication, Risk Assessment in Juvenile Justice, a Guidebook for Implementation. And with that, I will turn it over to Dr. Vincent.
All right, thank you, Jonathan, and good afternoon to those of you who are listening to the webinar today. I'm going to be talking about risk, need, responsivity, and managing risk and mental health for juvenile justice involved youth from a systems perspective. I'm going to be giving an overview of what the research shows works around implementation of risk assessment tools and the benefits that that can have for you in your various systems where you're working. I appreciate and want to thank everyone for submitting questions ahead of time. It was great to review those. I'm not going to be able to address all of the questions that were submitted, so I am hoping that in my talk I won't be able to, but I am hoping we're going to have some time at the end for you to ask questions if you didn't get it from the webinar. Here's a brief review of what we're going to be doing through this webinar. So I'm going to start out by just describing very briefly what risk assessment is. I noticed from the people on the registration list that most of you should have an awareness of this, so I will cover that very quickly. Second, we'll talk about the use of risk assessment, why we think it's a good thing to do in juvenile justice in particular, and I'll give you a little bit about the research background on that. Then I'm going to get more into the nitty-gritty of risk, need, responsivity as an approach for case management and how that actually works in practice. And I will use some results from an implementation study that we did that was funded by the MacArthur Foundation to illustrate these points. I'm also going to be showing you results from other people's work as well. Third, we'll talk briefly about mental and behavioral health and how that fits into all of this. We refer to that as the responsivity principle when we're talking about risk, need, responsivity approaches. And then I'll end with some conclusions. So to start, we'll talk about risk assessment and what that is. And again, I think most of you are aware of this, but when I'm talking about risk, I'm talking specifically about risk for serious delinquent offending or violence. And there are two basic types of risk assessment tools. There's short ones and there's long ones. The short ones and the long ones will both answer the question, is this youth at relatively low or relatively high or moderate risk for reoffending or being violent? That's what they're designed to do. The comprehensive ones or the long ones are also designed to give people an indication as to what most likely might be driving this particular youth's risk. That is what we want to focus on as our target of intervention, is what their drivers are, what we think is kind of responsible for that particular youth's risk. These tools have also been referred to as fourth generation of risk assessments or risk need tools. All of those terms are used. I don't use the term risk needs tool for a variety of reasons because it gets very complicated. So I'll just talk about these as comprehensive risk assessments. A few other points about this. What does risk mean? I think it's important to remember what we're talking about here. So risk is relative. I can tell you with relatively good accuracy using a validated risk assessment tool if Jimmy is more likely to commit an offense in the future than Johnny. So we can compare kids and say this person is at higher risk than that person. What we can't do is tell you that this person is definitely going to reoffend. We can't do that with any known degree of accuracy. But we can tell you with pretty good accuracy about what an individual's relative risk. So if a youth is identified as low risk, that means they don't need much intervention in order to decrease their risk. By definition, they're unlikely to continue going on offending. When we tell you a youth is high risk, that does not mean they are definitely going to reoffend. What it means is that they require more intensive intervention in order to decrease their likelihood of reoffending. We're going to be a little more concerned about this case, and we want to put some extra resources into this case in order to protect public safety and to improve the youth outcomes. What risk tools do not do is these types of risk assessment tools I'll be talking about today are not going to tell us about one's likelihood of sex offending. Those are specialized risk assessment tools that require very specialized training to complete. So I'm not going to be talking about sex offending specifically. These tools are also not designed to tell you about a youth's mental health issues. Mental health in some ways is tied to risk, and in some ways it's not. So we have separate tools that tell us about mental health because that's not what these risk assessment tools were designed to do. Okay. Also, it's important to be aware that risk assessment tools come in different forms. There's different tools designed for different purposes, and these are implemented at different decision points. It's not the case that one risk assessment fits all. I'm going to be focusing specifically on dispositional and case planning types of tools, risk assessment tools, and those will be the focus of this conversation today. Tools also differ in the way that they estimate risk. There's actuarial tools, which are formulaic. Those are the kinds of tools people are probably most familiar with. They've been around for a long time, and most of our tools are actuarial. There's also structured professional judgment tools, which are not formulaic. They are evidence-based, and they have research-based risk factors on them. They have guidance for how to rate those risk factors. But in the end, the decision about whether somebody is high or low or moderate risk comes from the professional because they incorporate a bit of their professional judgment into that decision. These approaches are equivalent in terms of their accuracy for estimating the likelihood of one's risk. So they have equivalent accuracy. The question about which one you decide to use really has more to do with your preference and what's going to work in your jurisdiction. There are also tools that I would call off the shelf. That means they've been previously validated. They've been validated hopefully in a variety of jurisdictions, and they should also work in yours. And then there are homegrown tools that people make on their own. These tools sometimes have been validated and sometimes not. I highly recommend that if you have a homegrown tool that you validate it and make sure that it is actually related to reoffending in your jurisdiction. Some final definitional points. I'll be talking about risk factors. There's different kinds of risk factors. So a risk factor is anything that increases the probability that a person will cause harm to others or will reoffend. Anything that increases the likelihood that somebody's going to offend in the future is a risk factor. We have static ones, which do not change, and these are typically historical risk factors. So things like the age at which they first started offending or the number of prior arrests they have on their record. And then there's dynamic risk factors. These are very similar to criminogenic needs. They're not exactly the same thing, but we tend to talk about these as criminogenic needs. These are changeable. So these are what we want to target for our intervention because they can elevate one's likelihood of reoffending, but in theory, if we reduce these risk factors or make them better, we will hopefully reduce one's risk. These are also what allow us to do reassessment, and reassessment, especially with adolescents, is very important because risk changes over time. And I will be talking about the dynamic risk factors much more later in this conversation. Lastly, there is another important factor, and that is a protective factor, and these are things that decrease the potential harmful effect of a risk factor. I like to think of these as a buffer. So these might be positive factors that a youth has in their life that actually prevent them from offending again in the future, or they protect them from it. And I'll be talking about those more later as well. There are two main risk assessment tools that we talk about a lot here in our work, and that is simply because they have the most peer publication evidence for their validity and reliability. One is the SAVERY, the Structured Assessment of Violence Risk in Youth. The other is the YLS, the Youth Level of Service Case Management Inventory. Both have a lot of evidence that they work, and they'll do it, but want them. There are other tools out there as well, the OYAS, the YAZI, and the Risk and Resiliency Checklist. These also all have publications behind them showing that they've got good validation. So the two tools I'm talking about are certainly not the only tools out there that are available for use, or not the only tools that we would recommend. Okay, so that's my short review of risk assessment. Why do we want to use this in juvenile justice? Well, there's many reasons. So one is, this isn't rocket science. I think most of us know that confinement is expensive. If we put youth in secure institutions, detention or correctional types of facilities, that costs a lot of money. This report came out from the JPI recently called Sticker Shock. I encourage people to read it, but basically they estimated the direct cost of confinement in the U.S. per youth per year is over $148,000. If we look at the total cost of youth confinement in the U.S. per year, it ranges very widely from 8 to 21. There's also research evidence from the Pathways to Desistance study that confinement actually has diminishing returns after 6 months. So if we put the high-risk kids in confinement, that may have a good and positive impact on their reoffending. It may decrease it. But if they're in there much longer than 6 months, we really aren't getting much bang for our buck. It's not really being a big benefit past that point. Sticking with the notion of costs, there is evidence. There are a couple good cost-benefit analyses studies that have shown that evidence-based practices that are done in the community can actually not only save money, but they work for high-risk youth. So this was one particular study that came out of the state of Washington. Essentially, for every dollar that we could be spending on confinement, if we spent that dollar on one of these services instead, we would be saving the dollar amount that I'm showing you there. So if we spent that money on functional family therapy instead, we'd be saving over $28. The reason we're saving so much money is A, community-based services obviously are less expensive, and also B, they work better to reduce recidivism, and they work in a shorter period of time than confinement. There was another good analysis done very recently by Romani and colleagues that's out in the peer-reviewed literature that did a cost-benefit analysis labeled "Is the bang worth the buck?" And they also found the same thing, that if you're using need responsivity services in the community, you are saving money. In addition to the money aspect of why a risk assessment is important, and risk assessment helps us determine who really may need confinement and who is very unlikely to benefit from confinement. That's an advantage that risk assessment does for us. In addition to that, there's also research evidence on the characteristics of effective programming for young offenders. So one point is that punitive sanctions do not seem to have a significant impact on reoffending, with all else being equal. The deeper youth penetrate the juvenile justice, that they end up in the adult system. And of course, there have not been any experiments done on this, so these studies have done the best they can to control these groups of people when they're comparing youth who end up in juvenile justice and youth who don't. And what they found, of course, is that there's adolescents in the community who do engage in delinquent behavior. They don't get caught. They don't penetrate the juvenile justice system. When you compare some of them to the youth that did, they have much better outcomes. Now this, of course, is talking about treatment as usual, where people are simply doing the time for the crime. They're not necessarily being sorted based on their risk and needs. So I think the juvenile justice system obviously does have a lot of benefits. It's just about, obviously it has a lot of benefits, and obviously it's very important, and for many kids it's going to improve outcomes. It's just a matter of doing it for the right kids, for the right reasons, and planning our interventions accordingly. Second, the severity of a youth offense is not a strong indicator of their future pattern of offending. It's just not the best indicator for telling us what a youth is likely to do in the future. The more serious the offense doesn't necessarily mean the greater the likelihood that someone is going to continue to be violent for a long period of time. However, tested static and dynamic risk factors are good indicators are well-tested, good indicators of what a youth is likely to do in the future, and there have been many studies on these. So there is a benefit to using risk assessment as our method for determining disposition and intervention, and it's better than using offense alone, the severity of one's offense alone. Now, obviously, the severity of one's offense alone is always going to dictate disposition or sentencing on some level, but to the extent that we can incorporate risk assessment in that decision, we are going to hopefully do a better job as well of improving outcomes for youth while still protecting public safety. Next, the research evidence indicates that most low-risk youth are unlikely to reoffend even if there is no intervention. So by definition, low-risk youth, they're unlikely to continue going on offending. However, if we mix them with high-risk youth, there is evidence that we can make them worse. Some of the hypotheses for why that happens, of course, has to do with what are known as peer contagion effects. Youth at this age are very susceptible to their peer influences. Deviant peers are more exciting. When we put low-risk youth with higher-risk youth, they tend to learn from the high-risk youth and start developing some bad habits. So to the extent that we can keep these groups separate, that's what we want to strive to do. Lastly, the good news is that what does seem to work is when services are matched to use actual level of risk, so that means matching our services and interventions to the intensity of them to one's risk level, and when we match it to their criminogenic needs, we're going to lower their chances of reoffending. So our goal here is individualized case planning, and that all starts with risk assessment. There are a couple important documents that have come out recently that have also strongly recommended that juvenile justice agencies use structured risk and needs assessment instruments to identify low-risk youths who can be handled less formally in community-based settings, also to match youths with specialized treatment, and to target more intensive and expensive interventions towards the high-risk youth. This came out from the National Academy of Sciences recently on reforming juvenile justice. There was also a white paper from the Council of State Government that came out with 4 core principles for reducing recidivism, where they speak about this as well. So, a lot of good reasons to do risk assessment. Now let's talk about how to actually implement risk assessment. Risk assessment alone doesn't do much. So if all we're doing is putting a risk assessment tool in place, that's really not going to do much. It should be paired with some kind of evidence-based case management approach. One of the ones that has been tested the most that we tend to talk about, so we tend to talk about that. What this is there's 3 primary principles that are very simple. First, we want to match the intensity of the intervention with one's level of risk for reoffending. Second, the need principle, we want to target dynamic or changeable risk factors. And lastly, the responsivity principle talks about matching the mode and strategies of services with the individual. Basically what this means is some individuals are not going to benefit from treatment unless we address some other issues in their life, or they will benefit from some treatments better than others. And some of the things that dictate that are youth characteristics like gender, age, culture, and then there's some more complicated responsivity factors like mental health. So if a youth has a major mental health problem and we don't address that first, it's unlikely that we're going to be able to do much work with addressing their needs, putting them in a regular juvenile justice center until we tackle the mental health issues first. So that's an example of a responsivity factor, and that's where I'm going to talk about mental health later, is in the context of responsivity. The earlier that you can put risk assessment in your process, the better. So there are many points at which risk assessment can be implemented. The earlier it's in there, the bigger influence it's going to have on more decisions. So some places, some states have implemented these comprehensive risk assessment tools pre-adjudication, in which case it can influence a diversion decision. It also can influence the disposition decision. And later it should it should continue onward to influence the actual case planning and the services that are going to be selected for the youth. Some places just implement it post-adjudication, predisposition, and some places just implement the risk assessment post-disposition. That also can work as long as the risk assessment can still influence the case planning. If the risk assessment cannot influence the post-disposition, then it's not going to have any effect there. As I mentioned, nothing changes without effective implementation of risk assessment. So a risk assessment alone is not going to lead to any changes in case processing or in the way that we handle youth. A risk assessment in and of itself is not going to do that. It's got to be paired with a very effective implementation strategy. There have been several studies of risk assessments being used in the justice system that have shown that the tools have been adopted. Some tools have been adopted by jurisdictions, but then they stopped being used because there really wasn't any buy-in and nobody saw the value. A probation officer would fill out a risk assessment tool, it would sit in a file and collect dust, and it would not be used in any decision-making. That happens quite often. And even when the tools are completed by probation officers and they stick around and there's some sustainability with respect to continuing to complete the tool, even in those cases, in many jurisdictions, it's still not being used to help guide any kinds of decisions that are being made about the kids. And that's what we want to avoid because that's kind of a waste of time and resources. There are several parts of the process and implementation that are really important, and it starts with getting stakeholder buy-in. It also requires having some policy changes about how the assessment is going to be used, how it's going to be done, at what point it's going to be done, and how it's going to be used in the case plan. We have put out a guidebook with 8 steps to effective implementation. This is available free for download off of a couple different websites. And the results of the study that I'm about to show you used essentially this implementation strategy for their risk assessment tools. And we put this guidebook together after the study that I am about to show you, which largely influenced it. So as I mentioned, many people believe, based on the scientific evidence, that risk assessment, implementing that in juvenile justice practice is a good thing. However, up until this point, to my knowledge, there were no published studies showing that once someone put a risk assessment in place that it actually led to any kinds of changes in the way youth were processed in the juvenile justice system. So the point of this particular study, funded by the MacArthur Foundation, was to see compare before and after a risk assessment tool was in place, whether it led to any changes in the way that youth were handled. What I'm going to be showing you are results from a multi-site study. It was a quasi-experimental pre-post study of the impact of implementing an evidence-based risk assessment tool in 2 states. There were 6 probation offices, 3 probation offices per state. The states either chose to implement the YLS or the SAVRI. So both tools were used here depending on the state. What we did was we compared samples of youth that were adjudicated or referred to those courts the year prior to the risk assessment tools going into place, but a standardized implementation procedure for the tools, and then we compared samples of kids who were adjudicated after the tools went into place or referred after the tools went into place, depending on the point in time at which the site had implemented the risk assessment. The number of kids that were in the pre and post samples at each site varied based on the size of the jurisdiction. It could range from 100 to 250 kids. Also, youth were tracked for up to 13 months during the length of time from their referral, so starting with their referral date, so 13 months after their referral date to the court or after their adjudication date. Again, it depended on where the risk assessment was put into place. So we actually looked at outcomes across the course of their probation or placement stays. We also followed them for 18 months, an average of 18 months to track their recidivism. There are several references for this study. These will be posted online so that people can grab these papers if they want to. There's also several briefs that have talked about it. I am going to mention, though, that we've only published the entire results from one sample at this point. So I'll be presenting to you some data that is not yet published. It's in preparation for being submitted for publication. The take-home message from all of this is going to be that implementing risk assessment is going to have a differential impact depending on how you do it and what your jurisdiction looks like now. That's going to be the take-home message. Here is the results from one jurisdiction that implemented the risk assessment post-adjudication predisposition. So after the kids were essentially found guilty, but before their sentencing. And in order to compare apples to apples, we used propensity score matching here, and we factored out a lot of covariates. So we took into account a lot of things, pre and post, like severity of the offenses the kids committed, psychosocial variables like their mental health history and their substance abuse history. We looked at the length of their prior records. We looked at their gender, ethnicity, and several other variables, and made sure that we had the same types of kids in both samples. So we're comparing apples to apples, trying to control for the only difference here being the risk assessment being implemented. So we find here that there was a significant shift towards less restrictive dispositions once the risk assessment was put in place. In fact, the use of detention was cut in less than half. The use of state commitment or correctional facilities was as well, and the use of probation increased. I should mention that we coded disposition based on the most serious disposition kids received. So most of these kids who went to detention spent a week or two there, and then they also ended up on probation. But those kids would be classified in the detention group here because we're looking at the most restrictive disposition. Then we also look at placement rates. Most kids, for those of you who are in the juvenile justice system, you know most kids are not put in an out-of-home placement at disposition. Usually it occurs much later after they violate their probation in some way. So we looked at two different time periods, the kids who were placed immediately after disposition, and then the kids who were placed during any time in the study, so across the 13 months. Placement here is defined as detention, an out-of-home residential placement, a secure correctional types of facility, kind of placement that would have a restriction on use civil liberties. We did not include foster care in here because those kids are essentially still free to go out and do whatever when they're in foster care, so that's not included here. So we're talking about any secure or semi-secure open placement. What we found is during the course of time kids were on probation, still the placement rates were cut in half after a risk assessment was adopted, and that's largely because people were making these decisions based on the risk principle. So you can see there 60% of youth, 60% of high-risk youth were put in a placement at some point compared to only 22% of low-risk youth. We should note that not all high-risk youth need to be confined in order to be safely managed in the community. Notice that 40% of their high-risk kids still stayed in the community for the entire time that they were on probation. So risk should not be, high risk is not equal to need for confinement. So placement rates were cut in half. We also looked at probation supervision. There was a significant decrease in the use of maximum supervision and a significant increase in the use of minimum supervision. This happened across the board at every site, and this is one of the biggest impacts risk assessment has. It's the easiest one to implement. Probation officers will be spending more time with the kids who need it and less time with the kids who don't. Last piece about the risk principle is that service allocation shifted. So high-risk kids got more services and low-risk kids got less, and that is also what you want to see. In summary, across all 6 of the sites, I'm just going to make some take-home points here that with respect to disposition, the shift that you see in your jurisdiction is going to really depend on where you implement the risk assessment tool and the quality of your implementation. But in 4 sites, they shifted to less severe dispositions, and that was significant. In 1 site, the severity of the dispositions went up, but that was not a result of the risk assessment tool, the SABRI that they put in place. That was because they put a detention screening tool in place that had not been validated, and that was being used to put kids in detention. With respect to placement rates, if you're implementing a risk assessment tool and you are a site that places a lot of youth out of the home, so 40% or more, you might expect a significant decrease in our sites that had that level of placement rate. The rates decreased, they were cut in half. And our sites that had low placement rates, 15% or less of their kids were put in a placement, their rates went up slightly to about 20%. And our sites that had moderate placement rates, so they were only placing 20% of their kids, there was no change. So essentially, this seems to balance out the playing field to put a risk assessment tool in place. Lastly, with probation supervision, there was a significant shift in supervision at all sites except the one site I told you about that didn't implement the risk assessment tool well. Service referrals, there was a significant shift in service allocation by risk level in 4 sites. Again, one of the sites didn't implement the tool well, it had no impact here. And another site was not using the tool in case planning appropriately, and it had no impact for them either. With respect to recidivism, and we tracked recidivism based on both new petitions or complaints or referrals, depending on what your jurisdiction calls these, and adjudications. And recidivism, surprisingly, we found that recidivism rates were not cut. In most of our sites, they had low recidivism rates to begin with. There was not an increase in recidivism rates, however. One site cut the recidivism in half. No sites had an increase. So when I talk about the utility of risk assessment tools, I don't think it's always about reducing recidivism. It should reduce recidivism if you have high recidivism rates, but you'll see a major shift in resources. More kids are being served in the community, more kids are being diverted, more kids are staying at home. That is a big shift in resource allocation, and there's no increased threat to public safety, at least in our states where we've done this. There have since been 2 more states where Laura Guy has done the studies, and she's found the same thing and did not have an impact on recidivism. Okay, that was the risk principle. Now I'm going to talk a bit about the need principle, which is much harder for people to implement. So when we're talking about dynamic risk factors, those are sort of equated to criminogenic need areas. There's 8 main criminogenic needs people talk about. I have criminal history highlighted there because it's not really a need, it can't be changed. But these are the general categories: family, pro-criminal attitudes, behavioral problems or personality traits, deviant peers, substance abuse, education, and employment. I also have leisure highlighted there because some people talk about this as a need. I think of it more as a protective factor. The research shows that it does not have it has probably the weakest association in terms of other, relative to other risk factors, and residivism. There are a couple studies, we have not done this yet or published it yet in our own work, but there are a couple studies that have come out of Peter Simbadali's lab, great work, showing that when used services they receive on probation are not matched to their actual needs. So they're not actually addressing the kinds of needs kids have. There is a significant impact on reoffending. So this particular study showed that I'll explain the graph to you really quickly. The group in the poor match, those kids had 30% or less of their needs addressed by a service. So they may have received multiple services, but those services didn't have anything to do with their specific criminogenic need areas. The good match group were the kids who 75% or more of their needs were addressed by a service. You can see the poor match group had a 75% recidivism rate. The good match group had less than 30% recidivism rate. Just that right there, irrespective of the kid's risk level, had a big influence on whether they reoffended. This is a later study these guys did just recently, actually breaking this down by need area. And what you find, the first bars in every place here by need area, are the percentage of kids who did not have a match. So, for example, in the family area, 75% of the kids who had family as a need, as a major one of their needs, did not get a service for it. I'm sorry, I take that back. The first bar is all of the kids who had a need in the family area who did not get a service for it and reoffended. So 75% of those youth reoffended compared to 40% of the youth who actually got a family service to address that need. And you can see across the board, except with substance abuse, which I find odd, I can't explain that, but across the board, kids who did not have their needs addressed were more likely to reoffend. This is the way that need matching is working in the field right now. It's very difficult for people to implement. It's not working that well. I think we need to do a better job of helping people to do this. This gives you a sense of how many youth had a need present and how many youth actually had that need addressed by a service while they were on probation. This is from one sample of kids, one probation office, one study. There have been a couple other studies like this, but we need to do a lot more. And you can see the personality, behavior, and attitude, those those criminogenic need areas actually have the strongest association with reoffending. Youth who have those needs tend to be the most likely to reoffend, and yet those are the areas where we're having the hardest time putting services in place to address those needs while kids are on probation. So the service matching is not going great. One approach to help improve this service matching is something that we call a service matrix. This is in our risk guide that I referenced earlier. A couple reasons that this service matching may not be happening well is one, that the communities just don't have the services to address these needs. So that's one issue, and we hear that all the time. A second issue is that probation officers, judges, whoever's making the decision about what services kids are going to get while their risk is being managed on probation, whoever's ever making those decisions may have very different opinions about what services are actually going to address a particular kid's need areas. So this service matrix is designed to try and tackle both of those issues. We help people fill these out for their jurisdiction. It's customized based on what services they've got available to them. It aligns the criminogenic need areas at the top. So all the major criminogenic need areas are there, and they use risk level at the bottom. The high-risk kids should have, the cells that are for the high-risk kids should have the most intensive services in them. The cells for the low-risk kids should really have no to little services in them because we don't want to give too much intervention for low risk. And the moderate risk kids need a moderate level of intensity. We also want services that are going to actually address these need areas. And we'd like to have everyone on the same page about what those are. So for example, if the youth has a disruptive behavior problem, CBT has been shown to be effective with that, or with personality issues, those really disruptive behavior problems. MRT, MST, ART, those are all services that can have an impact there. Filling out a service matrix like this for each probation office helps probation officers see kind of what kinds of referrals they should be making or striving to make in a use case plan. But it also helps the jurisdiction to see where the gaps are in their services. So if any of these cells are empty, that's a sign that some services are missing. And one nice thing about implementing a risk assessment tool is that it enables you to track data showing what the actual needs of your youth population are, so that you really have something to use to advocate for getting more services in your jurisdiction. If you've got a bunch of kids with substance abuse problems, and this is one of the main problems your juvenile justice population is coming in with, you should have some services to address it, and it will help you argue for that if you don't have them. This service matrix is just one approach. There are other approaches people use for this, but this is an area where I think the science could improve. It is an area where our implementation efforts could definitely improve, and this is something that we do when we're working with the communities that we help implement risk assessment tools. Another approach, if you don't have the services in place to address some criminogenic needs, another thing you can do is to help enhance the kids' protective factors. So this is a strategy I always recommend to people. If you don't have that cognitive behavioral therapy to address their disruptive behavior problems, you might use something that's the next best thing, but you also want to help enhance their protective factors. And in general, working on kids' protective factors is beneficial. There's a lot of talk now about how risk assessment is kind of deficit-based, and it is somewhat deficit-based. We're looking at identifying kids' problem areas, their targets for intervention. We want to also supplement that with strengths-based approaches, and enhancing people's strengths is certainly also going to help to reduce their risk. Some examples of protective factors are things like pro-social activities, so getting them engaged in pro-social activities, structured pro-social activities, getting them more attached to school, tutoring, anything that will help them do better in school. Attachment to pro-social adults or positive social support, big brothers and big sisters, is an evidence-based practice for high-risk kids. There's another example of a type of protective factor service that can be put in place. And this is just one example of a study. There's been several that have shown the relationship between, or the association between, protective factors and reoffending. We found specifically with a savory that the higher the used protective factor scale score, the lower the likelihood that they were going to reoffend. Others have found this. It's been shown with the Yazzie, which has a very nice protective factor scale in it. It's been shown repeatedly. Jennifer Scheme has done some work on this. Many people have written about protect us all to think about strengths, especially when we don't have the services in our community to be dealing with the risks. Now, lastly, I'm going to talk about the responsivity principle and for another couple minutes, and then we're going to stop for questions. What about behavioral health or mental health? Well, the adult literature tells us that treatment of criminogenic risk factors has a much larger impact on reoffending than treating people's mental health issues. Okay, we know that from the adult literature. In the adolescent literature, there are a couple of studies, very good studies that have been done that have shown that the criminogenic need areas that I told you all about already have a much larger association with reoffending than used mental health problems. So mental health diagnoses in and of themselves don't predict reoffending above and beyond what our criminogenic need areas do. What does that mean? Well, there's research also showing that there's a lot of association between some of these behavioral health problems or mental health problems and criminogenic needs. So youth who have conduct disorder, ADHD, or disruptive behavior disorders in general also tend to have a lot more criminogenic needs. It's associated with higher levels or elevations on criminogenic needs. If they've got comorbid diagnoses, that greatly enhances the likelihood they're going to have criminogenic needs. And if they've got substance abuse problems, that also greatly enhances the likelihood. Now, substance abuse is challenging because substance abuse is also a criminogenic need. When we're talking about substance abuse as a criminogenic need, we're looking specifically at the problem, at the relationship between the substance abuse and the offending behavior. When we're talking about substance abuse as a behavioral health issue, we're looking at the severity of the substance abuse. So they're slightly different. The youth who have substance abuse diagnoses are much more likely to have other criminogenic need areas. So essentially it looks like these mental health and behavioral health problems underlie some of the criminogenic need areas. Yes, the criminogenic need area has stronger prediction with respect to reoffending, and once you account for those, mental health and substance abuse don't have a prediction of reoffending. However, I wouldn't interpret that to mean that we don't want to address their mental health problems and their substance abuse problems. We think of these as responsivity factors, and in some of those cases, treating the conduct disorder is going to treat the criminogenic needs, or treating the ADHD is going to treat the used criminogenic needs. It's going to, the idea here is that we need to take this on a case-by-case basis. It's also important to remember that other types of mental health problems in youth don't have any association with reoffending, and if we're just treating those, we are unlikely to have any impact on their juvenile justice involvement. Those are things like depression, anxiety, and some mood disorders. So some mental health problems are important with respect to reoffending, some are much less important with respect to reoffending and delinquent behavior in general. And I think that we want to pay attention, especially to substance abuse and comorbidity. We may still need to treat that in order to treat the people's criminogenic needs. However, we don't want to do it in isolation. I think what the research tells us is that we need to address both these mental health problems and their criminogenic needs in order to be effective. So, in conclusion, several point take-home messages here. First, risk assessment paired with R&R can be used to conserve resources and improve outcomes for youth while still protecting public safety. How it does that is going to vary based on your site characteristics within your jurisdiction and the quality of your implementation. Implementing the risk principle, that should be done in all areas of case management, which I showed you: placement, supervision level, service allocation, and disposition. Whenever possible, implement the risk principle in all of those decisions. The need principle, We want to implement to the best of our ability, and if we can't address kids' needs, we really should be trying to enhance their protective factors and their strengths. It's best to try and do these in tandem. Presence of substance abuse problems are greatly going to elevate the likelihood of having other criminogenic needs, so we want to address them, but don't treat them in isolation. And lastly is a caveat I always make. If you're implementing a risk assessment tool, it's very important to get all of your stakeholders on board early in the process, your defense attorneys, your prosecutors, and your judges, so they're bought into the idea and it can be used in that disposition decision. When it's not, unless you're a state like Louisiana, which is one of the states where we did this study and found very, very good results, there's an example of one state where the probation officers are left to do the case plan, they're left to choose the services, they're left to do all of that post-disposition. If you're in a jurisdiction like that, a risk assessment can still have a very big impact if it's implemented post-disposition. But if you're not, you want to implement it as early in the process as possible. All right, so I'm going to stop there. I know that's a lot of information. It's a large topic. And see if Jonathan or Dee have questions for me.
We do have a couple of questions, Gina. One is, one individual was looking to see if there's a list of evidence-based risk assessment measures that they can access.
That is a very good question. We are asked that a lot. The answer is no. We're going to put that in the risk guide. We decided not to, and the reason is because the research is always changing. So the list I make today could be, we would be adding to that list a year from now. So there is no list that I'm aware of all evidence-based tools. There may be some that are a little older and maybe out of date. I think the best thing to do is to always just ask a researcher or ask. You can always send us an email and ask us. We review the validity and reliability evidence on these tools on a regular basis.
Another question was specific to ART, and what does that stand for? The person was saying it's one of the therapies that you mentioned that they didn't recognize.
Okay, yes, ART is aggression replacement therapy. I am not a treatment person, but my understanding is that it was created mainly for use within institutions. I don't know how widely it's used in community-based settings. I think it is in some places. I don't know what kind of success they're having with that. But anyone can correct me if I'm wrong on that. That's aggression replacement therapy. MRT is moral recognition therapy. MST is multi-systemic therapy. And of course, CBT is cognitive behavioral therapy.
Okay, we do have one last question, and then we'll be wrapping up the webinar. One person is asking what you mean by comorbidity.
Oh, sure. So comorbidity in the particular study I was referencing define that as just having 2 or more diagnoses. I think of comorbidity, I think are dual diagnosis as having a substance abuse disorder and a mental health disorder. Comorbidity here is just simply having 2 of any types of diagnoses. Any type of mental health substance abuse, yeah.
All right, and we do have time for just one last question here, and I'm going to have the person that has the question ask it.
Hey Gina, it's Marianne Davis.
Hi.
Hi, thank you for a wonderful webinar. As I was listening, I was just listening with sort of my ears on thinking about folks who may be sitting in mental health for pieces that might be important for them as takeaways. And one of the things that I just am less familiar with, you were talking about how mental health conditions, particular ones, can contribute to criminogenic behaviors or criminogenic factors, and don't. And I'm wondering about the reverse, which is, say I'm sitting here and I've got some young people that I'm working with, and I'm aware that they may be at risk of justice system involvement imminently. Is there a literature that suggests why I would be I might be particularly concerned about that in terms of its impact it might have on their mental health? So to be succinct about it, is there data out there or research out there that suggests involvement with the juvenile justice system in particular ways may actually in some ways complicate our treatment of somebody who has a mental health condition?
Yeah, it's a very good question. Thank you, Marianne, for asking that. So, I mean, one of the pieces about that that's being talked about the most now is trauma. Youth who have experienced significant trauma, and how going into a detention facility or a correctional facility can be all the more traumatizing. And that's not necessarily the environment that we want them to be in. So yes, there is some. My understanding is that there is some evidence that, you know, mental health problems can be exacerbated in some of these settings. Of course, if you can think of youth who are depressed, may end up being suicidal in some of these settings and so on. What we try to do, and by we I mean Canada Models for Change Initiative, people who are much better at this than me, Joe Kokoza, Tom Grisso, is really talk about trying to keep the kids who just have mental health problems out of the system, period. So when we talk about low-risk youth, you'll see a lot of low-risk youth who come into the justice system because they have mental health problems, and for some reason that got them into touch with the law, or people tried to bring them here to get them services or so on. Those youth we really want to see diverted out of the system and put into some kind of mental health diversion program so that they're not being treated in the same way. Now then there's other youth that have mental health problems like the disruptive behavior problems, conduct disorder, ADHD. You're going to see higher prevalences of that, or higher prevalence of that in the justice system. And some of these treatments should be, that the justice system has to offer, should be effective for those types of issues. So it depends on the mental health problem, which with kids is always a bit more complicated, I think. Does that answer your question?
Yes, Gina, thank you very much.
Yeah.
Okay. Thank you, Gina. It looks like we're out of time, but I just want to mention to everybody that's still on the webinar to be on the lookout for future email announcements of Spark webinars